Hey everybody, my name is Patrick on the agent development team here at Lori Life and Health. Today I'm bringing you an updated version of how I like to present Medicare options to my clients. This is the actual PowerPoint that I use when talking to clients about their Medicare choices, helping them decide whether they need a Medicare supplement and drug plan or a Medicare Advantage plan. And you can use this as well. Just if you're contracted with us, give me a call. I'm happy to put your logo on it and color match the color scheme for you. So, anyways, I'm going to go through this just like I was talking to a client. When I get finished, I'm going to circle back around and talk about why I say certain things in certain places. If you have any questions at all, feel free to give our office a call. I'm happy to talk to you, or just drop those down in the comments below and we will get those answered in the order that they come. So, to start off, I do like to talk about original Medicare. So, here we go. As far as original Medicare goes, at the very top of this chart, you see both Part A and Part B. Now, Part A is going to be your hospital insurance. So it's going to cover you if you have to take a hospital stay, a skilled nursing facility stay following a hospital stay, and then at the end of life, hospice care. So Part A, most people get that for a $0 premium. You don't have to pay anything for Part A. You've worked enough years, you paid enough payroll taxes, you've earned it. Now, as far as Part B goes, that's going to be your medical insurance. So, like doctor's visits, surgery, labs, x rays, things like that. Now, most people on Medicare do have to pay a premium for Part B. The base premium in 2023 is $164.90. Now, I say base premium is depending on what your client's income has been the last couple of years. They could have to pay a higher premium than this, but most people pay 164.90. And the only people that get around paying for Part B are folks that are part of the Medicare Savings Program, which I talked about in an earlier video. You can check that out. I'll pin that at the end screen of this video so you can watch it as well. Those are folks on Medicaid where the state pays their Part B premium for them. Now, that's as far as how original Medicare works. There are a couple big gaps though that you got to be informed about. Now, these aren't things you got to worry about because any additional coverage we talk about will cover both of these gaps. But the first gap is under Medicare Part A. Um, that is a $1,600 deductible. And unlike traditional group insurance that you might be used to, this is not a yearly deductible, but instead it's per 60-day period. So, for example, let's just say you take a hospital stay. You'd actually have to pay $1,600 just to get in the door. Let's say you stay for 3 or 4 days, you go home, everything is good. But heaven forbid you go back 3 months later. You have to pay this again because this deductible is per 60-day period you're in the hospital. Now, if you go back within that first 60 days, you don't have to pay it again. But if that 60-day period has expired, you'd have to pay this again. And that's the first gap and first out of pocket exposure that we got to get covered for you. Now, the next one and the biggest one is going to be under Medicare Part B. Now, Part B does have an annual deductible of $226 this year. No big deal there, filled on the first couple claims of the calendar year. Now, after that deductible is filled, though, Medicare is going to pay 80% of your medical charges. You are left with 20%. And this might not seem like a big deal, but unlike traditional group plans you might be accustomed to, there is no maximum on what they'll let you spend. So that 20%, that could be as much as $20,000, $40,000 if you had $100,000 or $200,000 in bills. And I don't want you to have to worry about that. So let's look at some additional coverage options to pick up that hospital deductible and pick up that remaining 20%. There's also some other gaps in original Medicare that I won't get into just because it gets a little bit confusing here, but these are the main two that you need to worry about. So, as far as where I would come in as an independent agent and where you come in as an independent agent yourself, you have two options here at the bottom. The first is a Medicare supplement, a Medicare prescription drug plan, and then you also could add dental and vision coverage if you want to. The second option is a Medicare Advantage plan, and then we'll also talk about what a hospital indemnity policy could look like for you to go well with that. So, to start with, though, let's talk about option one. And before I get into it, these options are very different. You really can't make a wrong choice here picking one over the other. You just got to pick the one that makes the most sense for you and that you feel most comfortable with. So, option one is a Medicare supplement. So, the way it's going to work at age 65, you're going to pay somewhere between $100 and $150 a month. Now, that premium is going to go up a little bit every year as you age. And this is also in addition to what you're going to pay for your Medicare Part B. So, you'll pay for Medicare Part B, and then you'll pay this premium for your supplement. Now, the way this plan is going to work, it's very simple. the most popular option is called a Medicare Supplement Plan G. And now, a Plan G is going to be standardized across the board. So, no matter what company we look at getting your supplement with, a Plan G is going to work like this. You will have a annual deductible of $226 that's associated with Medicare Part B. That's going to change a little bit every year since it is associated with Medicare, and those numbers are fluid from year to year. But after you have filled your Part B deductible for any services that are covered by Medicare A or Medicare Part A or Part B, you won't pay anything else for. You pay your annual deductible, then you're covered 100% for the rest of the calendar year. Also, there's going to be no network restrictions with a Medicare supplement. You can go to any doctor or hospital in the United States that accepts Medicare, and they will take Medicare, and then they will take your supplement as a secondary plan. So basically, for option one, you're staying on original Medicare. Medicare is going to pay its portion. Your supplement's going to pick up what Medicare doesn't pay as long as you filled your annual deductible. Now, at this point, I stop. I ask the client, hey, does that make sense? Are you tracking with me? Most of the time, they say yes. If not, I'll go back and I'll re explain something that's not making sense to them. The next thing I say is now Medicare supplements are really good medical coverage, but they are medical coverage only. And what I mean by medical coverage only is they don't give any sort of prescription coverage. They don't cover things like dental and vision. So I definitely recommend my clients get some sort of prescription plan. That's going to be a Medicare Part D plan, which are managed by private insurance companies, the same as the supplements are. I normally ballpark those right around anywhere from $10 to $50 a month in premium. It all depends on what your client takes. And then their cost of the pharmacy is going to depend on their list of medications as well, which you can use our proprietary enrollment platform, My Lori, to actually plug those medications in and price them by plan. So you make sure you're getting your client the best deal. And then also, I say a lot of folks do like to add dental and vision coverage since that's not going to be included in either one of these. Typically, that's going to be anywhere from $30 to $60 a month. So right now I'm just going to stop and ask them if they have any questions. Most of the time they're tracking here. Pretty simple Medicare supplement prescription drug plan. And then optional, they can add dental and vision offered by a separate private insurance company as well. And it's important to note here they can add dental and vision coverage whenever they want to. And that's completely separate from Medicare. That's the same dental and vision plan that that me or you would add at any time throughout the year. Or you or I, should I say. So option two, Medicare Advantage. Now, this is what you've seen all the commercials about on TV. You got JJ Walker and Joe Namath, and every third commercial during the annual enrollment period, it seems like it's about an Advantage plan. Now, these plans are a lot different than Medicare supplements, as we just talked about. It's not necessarily a bad thing, they're just different. And the way they work is most plans have a very low premium. Most of these Medicare Advantage plans are actually $0 premium plans, meaning the only thing that you're going to pay each month is your Medicare Part B premium. To have the additional coverage for an Advantage plan, it's not going to cost you anything. The difference is you're going to have copays and coinsurance, where option one, you just had that small deductible with a Plan G, then you're covered 100%. Medicare Advantage, you're going to save money each month by not having to pay that premium. That you're just going to have copays and coinsurance as you go. So, for example, to see a primary care doctor, it might be a $0 copay. To see a specialist might be a $30 or $40 copay. If you were to go into the hospital, you might have one of your larger copays. Let's just say $400 per day for the first 4 or 5 days. If you have outpatient surgery, you might have a $300 copay. An x-ray might be a $15 copay. You can see how these plans work. You save more money on the front end, and then you just pay for the services as you go. Now, I'm giving ballparks for those because here in Richland County alone, I'm talking about Richland County since that's where our office is at in South Carolina. I know there's 41 different Medicare Advantage plans, and their cost structures across the board are all a little bit different. So you don't want to give definites here since you're not looking at specific plans with your client yet. You just want to give them some ballparks so they understand how they work. Now, also, these plans include some additional benefits. Some of those additional benefits might be dental, hearing, vision, over-the-counter cards, gym memberships, even stuff like that. Some plans even include things like healthy food cards. So that's not necessarily going to be included with original Medicare or a Medicare supplement drug plan that you get with your Medicare Advantage plan. And once again, those additional benefits are going to vary widely across the board. Now, also, these plans include prescription coverage. So you're not going to have to pay an additional premium for your prescription coverage. It's all going to be bundled into your Medicare Advantage plan. Medicare Advantage is like one big bundled plan Where option one over here, you got original Medicare, then you have your secondary for your Medicare supplement, separate prescription plan, and a separate dental and separate vision. It's all going to be bundled under the same ID card here on the Medicare Advantage side. Now, another big difference is these are networked plans. So Medicare supplements, you can see any doctor in America that takes Medicare, and that's because you're still technically on original Medicare as your primary insurance. When you go on a Medicare Advantage plan, however, original Medicare is no longer primary. Your primary plan is your Advantage plan, which is going to be with Humana or Blue Cross Blue Shield or United Healthcare or Aetna, or the list of different carriers that offer these plans goes on and on. So now you are subject to providers that have contracted with that particular carrier and that particular plan. So they're most likely going to be HMOs or PPOs, and depending on where you're at, you'll have to decide with your client what's the right option for them. Now, the big benefit of Medicare Advantage, other than the additional benefits, is it does offer a maximum out of pocket. So right here, if you just had original Medicare alone, you're subject to 20% of any medical charge plus hospital deductible. And then actually after day 60 in the hospital, you'd have a copay. Over here, you're going to have a max out of pocket where you're still subject to some out of pocket costs via copays or coinsurance, but there is a cap, there is a limit on how much the insurance company is going to let you spend. Where if you're on original Medicare, this 20%, this hospital deductible, and all other associated costs do not go towards a maximum out of pocket limit. That's it. And then the last thing that I would want to talk about with my clients on the Medicare Advantage side, I just want to mention what a hospital indemnity policy is. Basically, for those of you who aren't familiar, I'll actually put a link in the end screen to our hospital indemnity video as well. But hospital indemnity or hospital protection plans can reimburse your client if they had to go into the hospital. As I mentioned, one of the major ballparks or one of the major copays, rather, if you go into the hospital, is going to be $300 or $400 per day for the first 4 or 5 days on an Advantage plan. The way these work, they could be anywhere from, say, $20 to $40 a month. They could actually reimburse your client if they went to the hospital, so they have funds to pay that large copay. They can reimburse them for things like ambulance rides, outpatient surgery. They even have a cancer benefit. Some of them do. Physical therapy benefit. There's all kind of ways you can formulate these plans to go with Medicare Advantage. The premiums on them are going to be less than a Medicare supplement. And I know we're even mean to make it sound like you get an Advantage plan plus an indemnity plan. It's the same thing as a supplement, because it's not. You don't need to talk to your clients and try to convince them that it is, but it can make your Advantage plan a lot more comprehensive than it is on its own. So basically, then, when I'm looking at between these two plans with my clients, I like to keep it really simple. You got your original Medicare. You don't want to just have original Medicare. I think that's pretty straightforward. That's pretty understood. You have two options. You can either pay more money in premium between a Medicare supplement and a drug plan and have more comprehensive medical coverage, or you can save money in premium. If you're really healthy, you go to the doctor a couple times a year. All you got to do is pay the copay when you go to the doctor, and that's it on top of your Part B premium. And then you get additional benefits, plus you don't pay any additional coverage or money for your prescription plan. So you're either paying more for a little bit better coverage, a little bit more comprehensive coverage, or you're paying less and you're paying copays. This is really as simple as that. And that's how I explain it to my clients. Another really important thing to remember, when somebody's turning 65, they get a Medicare supplement without any health questions. So this is their opportunity to get in a Medicare supplement with no underwriting. If they decide to go with a Medicare Advantage plan right out of the gate and later on decide to go to a supplement, they could have to answer, or they will have to answer health questions, at which point they may or may not qualify. Whereas if they start with a supplement and decide to switch to an Advantage plan down the road, as long as they have an enrollment period, they can do that with zero health questions. That's an important thing to communicate to your clients as well, just so they can make the most informed decision possible. So if you have any questions about this, or like I said, if you want to get a copy of this PowerPoint with your logo and your color scheme to present to your clients, just give us a call, 803-256-2067. The number is also down in the description below. Check out the two videos on the end screen here in a minute, and make sure to subscribe to our channel so you don't miss any of the great content that we're putting out there for you. So until next time, hope everyone has a great rest of their day, and I look forward to talking to each one of you very soon.